morning, viewers. Welcome to Lawyer to Lack live streaming. I am your host, Ozobli Solum Tojikon, and today we'll be discussing the topic Patients' Rights in the Face of Negligence by Medical Personnel. Some persons may wonder why this topic, and it's because there are lots of reports on social media and newspapers of harms incurred by patients as a result of the negligent care provided by medical practitioners. In November 2019, a woman lost her son and took to Twitter to tweet about how she lost her son due to the negligent act of a doctor. And it was reported to the National Medical Association, and it's true the matter was treated and the doctors involved, they were sanctioned. But this is the case of so many other persons, and when a doctor is negligent, it affects the lives of patients. Let's not forget that the patients still have their right to life, they still have their right to dignity of persons, they still have all the rights as enshrined in the Chapter 4 of the Nigerian Constitution. A survey was conducted, and the result from this survey is that 61.9% patients feel that medical practitioners in Nigeria are arrogant, careless about the conditions and plight of patients. You might wonder who are medical personnel. Medical personnel are doctors, nurses, all those who work together to see that the health of a person is being attended to once the person comes to the hospital. Every single individual have their right to health. In Nigeria, it is enshrined in the Chapter 2 of the Constitution. Although some can say that's not justiciable, but the court have made us to understand that once the legislature have made laws as regards to Chapter 2, it automatically makes it justiciable. And the legislature have made laws as regards the Public Health Act. We now have the Public Health Act. We have the act for those who are injured, for them to be attended to. So we see there are laws that talks about the protection of the right of a person in the hospital. The health right of everybody matters, and doctors and other medical practitioners need to look out. This live streaming is actually to bring to the consciousness of people that doctors owe them a duty of care, owe them a duty to be diligent in carrying out their duties. Because when a doctor or a medical practitioner is not diligent with their duty, it affects the patient. A lot of persons in the rural communities suffer more damages than what even brought them to the hospital because of the way they were attended to. And a survey was conducted and showed that 33.3% of Nigerians and patients indicated that going to the hospital had caused them to come back with more illness than what even took them to the hospital in the first place. So doctors owe patients a duty of care, and once there's a breach of this duty of care, it's either a causation or a negligence on the part of the doctor, and it's no longer a time where the doctors are seen as almighty. The Nigerian Medical Association president reported that these things happening is as a result of total systemic failure. The way lack of medical personnel, instead of a medical personnel to 600 persons as the World Health Organization have prescribed, you have one medical personnel treating a lot of persons. And yes, it can tell on the health of the medical personnel in question. So it's a time for both government and people to advise and look at our medical health system. We are in a period of a pandemic, COVID-19, And if our medical system is not attended to, a lot of persons are going to contact COVID-19 and would not even know that they have COVID-19. Or when they get to the hospital, instead of them to be treated of the sickness that brought them to the hospital, they will be treated of COVID-19. So we need the right equipment in our hospitals, in our public hospitals, so that patients and the masses can receive the adequate treatment and the adequate health care they require for them to get better. Considering the rights of the patients and the effect of negligence on their rights, I will be recommending that there should be something called a satisfaction index at every hospital, so that government can monitor the result or the people's mind as it relates to the health care they've received in a healthcare facility. And aside from that, there should be a patient-centered care circular in institutions where medical practitioners are trained. They should be trained for them to value lives and know that lives of patients matter. Just like in business where they say the customers are right, the patient needs to be treated with utmost due care. And until that is done, and until the human rights of patients are brought to the consciousness of medical practitioners, this practice of negligence leading to death of some persons or leading to people leaving the hospital with worse illness than what took them to the hospital will not be addressed. So there's a call on government and other civil society to sensitize to people, sensitize those in the rural areas so that they will know they have a right. These medical practitioners owe them that duty of care. So that when there's a breach, there can be a reportage and we can start advocating towards a better health care in Nigeria. Thank you very much for joining us, and we are receiving questions. We are open to your questions. Ask your questions and they will be treated effectively. Don't forget, I am your host for today, Ozo Blusolum Tochukwu. Thank you very much.